Hello, welcome to the Society of Hospital Medicine's Education Consult Series. Today we're talking with Dr. Lily Ackermann of Thomas Jefferson University and Dr. Lin Zheng of Cooper University Hospital. I'm Dan McFarlane from the Ohio State University. Today we're going to be discussing coaching students on oral presentations. Our learning objectives today are going to be assisting learners to develop and give effective oral presentations. We're going to explore other benefits of evaluating oral presentations to your learners, and we're going to define the benefits of other areas like simulation-based criteria in assisting in developing clinical reasoning and oral presentation skills. So Lily and Lin, I wanted to ask you about something that I've been struggling with lately. I have a group of learners from various different backgrounds on my team, and I found that they've had really a lot of struggles with their oral presentation skills, and the level of ability that they have has been very different. I have a learner who is a PA student. I also have a learner who is visiting from another institution, and I'm finding that they're really struggling to be on the same page with their oral presentations. And I was hoping that maybe you had some tips that could help me today.
So there are no uniform guidelines for MS3 students, PA students, NP students, and each institution has their own guide. So acing an internal medicine clerkship can be a unique challenge for early learners as they navigate their learning environment, moving out of the classroom onto the wards.
Yeah, so this is Lin from Cooper University Hospital. So like Lily said, the challenge is there's no universal the guideline or curriculum to guide the student to give the effective oral presentation. And each individual organization has its own culture, has its own team dynamic. So how we prepare our student to know their own role in this team's based the environment, how we learn by doing the effective oral presentation. So that's a focus of what we're going to talk about today. Of course, there are a lot of challenges, as Lily just mentioned, because we don't have a universal guideline or curriculum to guide us through. So we're going to talk about the approach we think are effective based on our personal experience.
The role of the student on the team can vary based on the experience and time of the year, the amount of responsibility that they get, and their role is as a student is not really to do floor work like the residents, and they're also not expected to learn efficiency. Students learn in the environment by interacting with a lot of members of the team. It's important for them to have clear responsibilities and concrete expectations. Giving feedback to their teachers and getting feedback can be a challenge. They also are responsible now for self-directed learning, especially when there's time constraints. They're also developing their own skills as a practitioner.
So Lady, how we give effective orientation based on the literature, like as evidence and our own experience as an educator?
So there are each different common presentations, and each type of presentation has an individual goal and format. Daily presentations, of course, are patients known to the service. For newly admitted patients, the presenter is usually the clinician that performed the H&P. For newly admitted patients overnight, the presenter received the handoff and the H&P was performed by others. And for outpatient clinic presentations, there's several common situations, such as an urgent care visit versus an established visit.
So Lily, are there different tips for each of these different presentations? Should I sit down with my learners and talk about each of the different presentations individually, or is there a universal sort of tip sheet for them?
So I think for each presentation, the goal of the presentation, definitely varies. So for your initial H&P, obviously to understand why the reason the patient was admitted, reviewing key history, exam, imaging, and labs. That is part of newly admitted patients, as well as some new events that happen in the daily presentation. It's also important for them to know, does the impression and plan make sense? That's often a difficult skill for new learners to develop. And also having them reflect back, does the data support the working diagnosis, and also their impression and plan? Do the plan tests and consults make sense? And especially for a handoff received by others, where they're reviewing someone else's impressions, what should be considered both diagnostically and therapeutically.
That's great, Lily. So in any given teaching team, we have a multiple member. We have an intern, we have a resident, we may have a PA student and medical student. So there are multiple different type of oral presentation like you just mentioned. So we'll do the oral presentation differently if you're talking to your intern compared to your oral presentation to your attending.
Yeah, so I think they found just in surveys of undergraduate MS3 clerkship directors, for example, that kind of coaching your learner, that a mean presentation time of about usually 7 minutes is ideal to kind of to keep on this timeline. It is, and to know your audience workarounds just with the students and residents are different from formal rounds within attending. They should also go through a priority assessment and plan, and also, to really understand that the purpose of the presentation is how to tell a medical story, and that the listener should see the patient the same way they do and to come up with the same diagnosis.
Yeah, that's a great point. So, as an educator, I always tell my learn to focus on the the purpose of a presentation. Is this like a formal or presentation for initial presentation to attending? Is this oral presentation to just for the sound out between the medical team, between the resident? Is this oral presentation and in front of the patient and their family? So different oral presentations serve a different purpose and with different focus. So as a learner, also as an educator, we need to look at the audience, make sure we understand what information we want to get delivered, and basically tailor our oral presentation.
So one of the other things too I was thinking about was, I think that's really helpful. I think that I have different hospitals that present in different places using family-centered rounds or bedside rounding versus other types of rounding. So I think about what other things could my students learn from this process. I know that they tend to write notes similarly to their presentations, which isn't always exactly what I want them to do. So what other things could they learn from learning and optimizing their oral presentations?
So the notes writing process for a lot of learners and also for us is a process we exercise our critical thinking. So the time for us to compile the medical information and exercise our decision-making capacity. So I think it's a great process for us to sit down and digest all the information and come up with great assessment plan and incorporate this into our oral presentation. Because remember, the oral presentation is a process of transform the information from the learner to the team for better patient care. So we also want to emphasize the bedside rounding because in the past decade, a lot of teaching shifted away from bedside to the table rounding. So, but there's a lot of information we could get missed if we, stay away from the bedside. So one particular instance, we want to focus on the physical examination. So which is essential for us to come up with the best assessment plan and incorporate into our oral presentation for better patient care.
So the Association of American Medical Colleges identified a list of activities expected of med school graduates entering residency, which are called the entrustable professional activities. This is direct observation and deliberate practice of these activities in the clinical settings. And it does have multiple challenges to be able to observe these. Many programs have developed a simulation-based curriculum throughout the MS3 and MS4 years that incorporates multiple opportunities for assessment during each exercise. So this was a study for looking at pre-clerkship students where they have case-based simulation workshops. It's medical students don't perform as well early in their clinical clerkships compared to clerkships that happen later in the year. This was an important simulation-based curriculum about what happened to the hospital floor, and this is something that you can do with your learners. Ask them questions if the clinical scenario were to change, ask them for a contingency plan if their patient were to decompensate, and ask them to look forward to discharge plan and discharge barriers. And again, other things that you can do on the wards are encourage learners to review clinical questions and real-time retrieval. This was a model of our curriculum to provide assessment of EPA skills that you as an attending can bring to your ward teams and encourage them to engage in transition of care, for example, informed consent scenarios or clinical change scenarios.
Wow, thank you guys. I really appreciate that. I love those key points of sort of taking, not only helping them learn about the oral presentation and how to do that efficiently, but then taking that learning to the next level and really helping them work through their clinical reasoning. I think you bring up some good points that obviously the more opportunities they have, whether either real and observed scenarios or in simulation scenarios, they're going to be certainly better at developing those skills and doing those oral presentations. So hopefully I can do a better job of aligning my students and sitting down with them and walking through the different types of presentations that you've showed us, and then we can hopefully use those to strengthen their clinical reasoning skills. I appreciate your time.
Thank you.
Thank you.